Shalom. Welcome back to FMR Therapy. True story. I decided that I'm going to do a video on frozen shoulder. I've got a couple gals in the clinic right now that have been battling with this, and so we're working on it with them. And there's one little exercise that I've been having them do, and I'm like, I need to make a video. So here we are. But, true story. I was like, there's a clinical name for frozen shoulder. Let me be a professional. Let me just make sure that I say the correct terminology, which adhesive capsulitis. So here we are, talking about working on adhesive capsulitis. And so the first thing that comes up, it's from the Mayo Clinic. Frozen shoulder, also known as adhesive capsulitis, is a condition characterized by stiffness and pain in your shoulder joint. Signs and symptoms typically begin gradually, worsen over time, and then resolve, usually within 1 to 3 years. What? 1 to 3 years? That's ridiculous. That's unacceptable. We're going to work on this now. So here's the deal. Generally, when people come to me with frozen shoulder, or someone has told them, diagnosed frozen shoulder, has told them that they have that, you know, sometimes that's after an injury, sometimes it's not. It's from out of nowhere. Listen, ligaments, cartilage, tendons, the joint capsule itself, all of these things do start to change over time. And all of these things definitely have a relationship to hormonal balance. So that's why we kind of tend to see this in ladies, and we can see this in both shoulders instead of just an injured shoulder, ladies that are, you know, now kind of, getting a little longer in the tooth, right? Because our hormones are totally shifting and changing and whatnot. So there's a lot to this that isn't just what the heck is wrong with my shoulder. That always gets me concerned about MRIs and other kinds of things that you might see that's going on in that shoulder. You might start blaming that type of stuff. Let's just get it moving again. 1 to 3 years, totally unacceptable. Get it moving now so that you can restore that movement and get rid of that pain. I always kind of see this like elevation of the trap, so I want you to pay attention to that. When you start to reach out to do things, if you're reaching up like this to reach out, or if you're trying to put your arm up in the sky and you're reaching up with that shoulder, step one, don't do that. Just have a little bit more awareness, have a little bit more control, try to press that thing down as you reach out, even if it limits how much you can reach out. We're going to work on this, and we're going to do it slowly but surely. We're going to teach those muscles to recreate a better joint capsule, kind of get those ligaments, tendons, and everybody else involved again, okay? So what we're going to do is go on the floor for this one. We're going to call this the Fro-Yo, right? Get it? Frozen shoulder. We're going to do a little yo-yoing action, a little windshield wiper with the Fro-Yo. Okay, on your backs, please. So the first step is to try to get that elbow to wing out, right, at what we might call like a 90-degree angle right here, okay? So if when you start to go out, this shoulder is shrugging up, we don't want to go out that far. We want to stay a little bit lower wherever that shoulder's not shrugging up. We're always trying to avoid teaching a poor pattern. So I want you to think about, kind of pushing your shoulder downward, down by your pocket down there, and then bringing that arm out as far as you feel comfortable going. Avoid pain and avoid the shrug. Now what we're going to do is we're going to try to keep this upper arm toward the floor. So you're going to try to actively press that upper arm toward the floor. So if you can get that elbow up here and have that upper arm toward the floor, excellent. Here comes that yo-yo. So we're going to take this upper arm, or the forearm rather, and we're going to start dropping our palm toward the floor as far as we can go. And by as far as we can go, I mean there's no pain and there's no shoulder lift, right? Nothing's changing, nothing's moving. My elbow isn't shifting, and I'm not getting any pain. You might stop real quick. There might be no go, right? But that's okay. That's your window of opportunity right there to work here and then try to push yourself each and every time you come to this exercise. So palm down is one direction, and then back of your hand down is another direction. You guys, some of you are going to be able to go palm down, but you can't go backhand back. Totally normal. Some of you are going to be able to go back of the hand back, but you can't go palm down. And then finally, some of you are not going to be able to do either one of them, and so your yo-yoing is going to be very narrow, but that's okay. That's what we're working on, is teaching the shoulder how to rotate again, right? So upper arm on the ground, elbow as far out as you can get it. Think about that chicken wing action, right? And then bringing your palm toward the ground. We want to be able to go, to about maybe normal would be like a 35, maybe a 40-degree angle here. And then really normal is actually getting the hand all the way to the ground over here. Breathe while you're doing this. Move slow. Okay. Now let's say that you can totally do this. You're like, this is not a problem for me, but I still get that shrug when I'm standing up. So let's start loading it. So I've got a couple options to show you here. This would be a pretty aggressive dumbbell. This is a 5-pound dumbbell, 2.5 pounds on either side. This is pretty freaking aggressive. So if you can do something like this, awesome, right? Let's get started. You're probably ready for the next level. If you can't do something that heavy, 2 pounds is totally normal to mess with, right? Where you're allowing the weight to bring your hand down as far as you can go, allowing the weight to almost give you like a stretch. But again, you're always looking for this, okay? And breathing and being normal. Let's say you can get down here, but you can't come back up. Reach over, bring yourself back up. Let's say you can get here, but you can't come back up. Reach over, bring it back up. Just help yourself get into that. Let's say you don't have dumbbells. Little Amy's organic soups, huh? So here we are, upper arm down, and I'm using my soup to just kind of help me bring my forearm into position, give me a little bit of resistance, and teach my shoulder how to rotate again. You guys, that is your Fro-Yo rotations for your shoulder. Let's do this all the time. Let's do this every day, especially if you're getting that shrug and you're in a ton of pain. Work within your body's limits. Don't work until you have pain. Work before you have pain. Might take a little practice to find out what that is. All right? And we'll see you next time. Thanks for sticking around.